Hi, I'm Dr. Reinhardt from Briar Patch Veterinary Hospital. Some of our clients have questions about what happens during a cat dental procedure, and we've written some of those down, and my assistant Jet is going to ask those questions.
Dr. Reinhardt, why does my cat need anesthesia for a dental procedure?
It's a good question. Anesthesia is very necessary because we are going to do potentially some things that might be a little bit painful, but especially because we are going to use a lot of water to do the cleaning and the polishing, and we're going to do full x-rays, which involves manipulating an x-ray plate around the cat's mouth, which they really have to be sleepy for. And then especially if we're going to do extractions, those really require full anesthesia.
Are there ever any circumstances when a cat can get their teeth cleaned without any anesthesia?
Not really. The protecting the airway is really, really important. And the way that we clean teeth is with a scaler that has a lot of water involved. Just like when you go to the dentist and they use all that water, we can't teach our patients not to swallow and not to inhale that water. So we protect their airway with an endotracheal tube in their throat to protect their airway during the procedure.
Why are antibiotics and pain medications sometimes prescribed for my cat's dental care?
Well, pain medications are probably self-explanatory. Whenever we do extractions or anything painful in the mouth, we really have to provide our patients with pain relief after that procedure. Antibiotics are maybe given less often, but if there is a severe infection, if there's an abscess, and if there are extensive surgical procedures done in the mouth, then we will also prescribe antibiotics for that pet.
Is there any way I can know if my cat will have a reaction to the anesthesia?
So that's also a good question. Everyone's a little worried about anesthesia, and understandably so. We do everything we can ahead of time to evaluate your pet and make sure that we have covered as many of the risks as we can. We do full lab work on your pet prior to them having anesthesia. We also check a pre-surgical EKG to look for any cardiac concerns, and if anything comes up on those tests, we also investigate further before we will do anesthesia for your pet. I hope that helps answer some of your questions. If you have more, please give us a call and we'll help you schedule an appointment to go over those.